Hey, my name is Ellie Small. I am a third-year medical student at Michigan State University College of Osteopathic Medicine. My Schweitzer Fellowship project centers around providing foot care within the world of street medicine in Detroit. And my motivations for this project were based on both feedback from individuals experiencing homelessness and my personal experiences and observations within street medicine, both as a leader and a volunteer. Foot care is an often overlooked aspect of care, though many individuals we serve often rely on their feet as their major mode of transportation. And we've seen this discrepancy both in shelters and on the streets. So it's my hope for this project to play an active role in providing resources and support and training necessary to properly meet the needs of those we're serving. In street medicine, our priority is to deliver patient-centered care, and we can only achieve this by aligning our goals with our patients' reality and advocating with rather than for the communities we're serving. It's my feeling that the Schweitzer Fellowship is providing me with a platform to serve my community and create a sustainable program that will last long after my time with the project has come to an end.
I'm Quinton Jenkins. I am a second-year Master's in Public Health student at the University of Michigan School of Public Health, where I study occupational and environmental epidemiology, and I am part of the Schweitzer Fellowship program. As part of the fellowship, I work exclusively with the Green Door Initiative, which is a nonprofit based in Detroit, and it works with local community members, both adolescents and young adults, and getting them prepared for what they call the green economy. So getting jobs, getting certifications, and environmental awareness related jobs. And specifically what I do for my project is we work with the local Detroit youth at the Hope Academy, and we expose them to different environmental awareness, advocacy, and activism approaches to protect themselves and their family against different environmental stressors, as well as teaching them about the social determinants of health. My role as a fellow has also been enriched by the National Fellowship as a whole. I think I've learned a lot about capacity building, social entrepreneurship, and what my purpose is inside of a much larger framework. I think that the fellowship, not only from a local perspective, but from a national perspective, has truly committed itself to advocating for the most vulnerable communities and truly giving the fellows the resources and the mentorship and like the collaborative expertise to work with their co-fellows as well as administrators to make sure that the shared mission of the nonprofit as well as a national organization is maintained. I look forward to becoming Albert Schweitzer Fellow for life once I finish my program, and to fully take advantage of the esteemed cohort that the fellowship currently has.
Hi, my name is Ashleigh Peeples. I'm a fourth-year medical student at Wayne State University School of Medicine, and I'm a 2020-2021 Albert Schweitzer Fellow. My project is working with the PACE, Southeast Michigan. PACE is the program for all-inclusive care for the elderly, and my project specifically works to target and identify and remediate features within the home environment that can cause and contribute to falls and injury within this population, focused specifically to promote safe and independent living among aging adults. The project will, as outcomes, focus on home hazard self-assessment scores or fall risk scores, and improve functional outcomes through reducing unintentional or reversible or preventable falls, and increased utilization by members within this community. Working and being part of the Albert Schweitzer Fellow has been a wonderful experience for me. It's an opportunity that I was really seeking to expand and connect the ideas of medicine and service and care to patients in need, but in the way that is from the community and community-based. And as being in medical school, things are very technical. The education that we receive is very book-based, and being a part of this fellowship has helped remind me why I actually chose to pursue medicine, and also to expand my ideas of what I can do as a physician to really serve patients in need.
Hi, my name is Jeannie Ali. I'm a third-year PhD student at Wayne State University in the Nutrition and Food Science Department. My work is in community health, specifically in food insecurity and disease risk. My fellowship project focuses on food insecurity and the pregnant populations in Southwest Detroit. What we hope to do is lower the food insecurity rates and therefore hoping to lower disease risk that they might face. I'm a Schweitzer Fellow because not only does the fellowship promote positive change in communities and in health and humanitarian efforts, but it focuses on sustainability, which is super important in my line of work.
Hi, I'm Sean Jones. I'm an MD MBA student here at Wayne State School of Medicine and Mike Ilitch School of Business. My proposed project is working on something called JADA, Joining Adults and Youth with Disabilities Through Access. And that's particularly working with individuals who have different abilities within the community. The Albert Schweitzer program has supported my humanitarian efforts with working within the community, has sharpened my leadership skills, and has enabled me to work as well on my social entrepreneurship skills, and with full support from not only from staff, but also my fellows.
Hi, I'm Nona Bhatia. I'm a third-year medical student at Wayne State University, and I'm working on creating an anti-violence curriculum for the youth at Auntie Nee's Village. I became volunteering with this community organization during my first year as a medical student, and I applied to the fellowship as a way to really get more involved in the community and kind of take another step past just being a medical student volunteer. And as a medical student, we work with patients and we really look at what we can do to help them in the moment. But I feel like we don't focus on the social determinants of health as much as we could. And as someone who wants to pursue psychiatry specifically, this project was a great way for me to learn more about mental health illness and the prevention of it using like different sorts of therapies, different stress relief methods, really to prevent violence before it even occurs. And with everything going on in COVID, I have learned more about like leadership, being innovative. And although I haven't been in the community as much as I originally intended to, this kind of brought a new dynamic to organizing and taught me more about virtual leadership.